Hello, everyone. My name is Marty Guthmiller, CEO at Orange City Area Health System, bringing you yet another COVID community briefing. I wanted to share this with you today, as we have just shared this with our staff, some steps that we're taking here at the health system. And so I'm going to be reading from some notes that are really come from our community or our staff meetings today. Due to increasing rates of COVID-19 in our region, in our area, our health system and amongst our staff, we'll be going to universal masking here on the main campus, effective at 7 p.m. today. We've seen increased volumes of people needing care across our facilities. And obviously we have an obligation to ensure that we have staff to be available to provide the care that is needed. We come into contact with people obviously at high risk and on a regular basis, and because of the work that we do, we feel that we're held to a different standard than perhaps in the retail environment, as an example, or in non-healthcare setting. And so we will be going to universal masking effective 7 p.m. today. Well, what does this mean exactly? This means simply that masking is required in all areas of the hospital and clinic, including hallways, break rooms, all that in terms of universal is universal. We'll probably be seeing some barriers going back up. All patients and others entering our facility will be required to wear a mask. We'll be more vigilant with that. But we wanted you to understand and know that in advance. Our cafeteria will remain closed to the public. That was closed this morning, and that will remain closed during this time as well. What's not changing is our visitor policy. And so we are going to continue to have unlimited visitors at this time. But all those visitors will need to be masked for the entire time that they're here, including in the patient's room. And so the good news is you can still come. The bad news is you will need to be wearing your mask the entire time here. We continue to ask our staff to self-screen at home, and we certainly encourage everyone that if you're ill, not feeling well, or even thinking about not feeling well, you just stay away. And that should be true anywhere right now, that if you're sick, please stay home. In terms of the vaccination process, we are not mandating the vaccine here for our employees. These steps are being taken so that a mandate is not necessary. We do, however, encourage all of our staff and all of the public to be vaccinated. We still believe that that is the best route to go. Clearly, there are less ramifications to the vaccine than to take your risks with COVID-19. And if you have any questions regarding any of that, please feel free to contact our clinic, and we can talk you through the wheres and hows of getting vaccinated. Again, the booster situation is not yet approved, not yet in place. So more news to come in the future when the boosters are out there. How long will this last? Well, that's a good question. Sanford is really thinking at this point that we're in a 4 to 6 week cycle where it'll go up and down within that cycle. They have been right in the past. I'm not saying they are this time, but they clearly have a lot of resources and a lot of research behind the positions that they've taken. And so we're really talking about the next 30 days. We're going to know, what's going on, but we really feel the next 30 days is critical. So how long this will last is going to be a weekly decision. Our task force will increase the number of meetings that we're having from once a week to at least twice a week. And we'll be looking at data. The data that comes out now is each Thursday morning, We'll have fresh data to look at. That's one of the reasons I didn't review data today, is that it is no different from what we reviewed on the last briefing. So we're looking at this right now, most likely a minimum of 2 to 3 weeks, but probably 30 days, and we'll reevaluate as we go along. We know that this collective COVID-19 burden is real and is manifesting itself in many different ways. It manifests itself in terms of staff burnout. It manifests itself in terms of people maybe saying things they wish they didn't say, in many different ways, mental issues and the ability to cope and deal with it. So there is no question that the collective COVID fatigue is real and burden is real. We ask again for your kind and considerate responses to our staff. If asked to put on a mask in our facility because you forgot, please say, oh, sure, thanks. I appreciate that, appreciate what you do. We appreciate that. But also be kind to one another. Extend grace to one another. Maybe more than they may deserve at the time, but that's not the case. We don't measure that. We measure extending the grace and giving grace and being kind to one another in a situation. Again, there are a lot of things going on in a lot of people's lives today, and we just ask you to really keep kindness in the forefront of your thoughts, extend grace to one another, and we'll get through this together. One of the things that we have to keep thinking about is our local access right now is good. Our clinics are being stressed. We're seeing a lot of activity in our clinics, not all COVID related by any stretch of the imagination. There's just a lot of other stuff going on. And this is true also in our transfer facilities in Sioux Falls and Sioux City. They are not full with COVID, but they are full with a lot of other stuff, and not full, but their capacity is being stretched. Part of that capacity being stretched is the fact of staffing being very low at this point. The state of Nebraska has implemented a staffing emergency with no elective surgeries through the month of September in Nebraska facilities, unless they're really needed. And so we want to do everything we can to preserve our capacity to care for you and all folks that are presenting to us. So, despite being worn down a bit, no question about it, our staff is executing what they're trained to do. I'm very, very proud of all the things that they're doing. I am amazed by the resoluteness that they exhibit on a daily basis, and very, very proud of being part of a team such as that at Orange City Area Health System. So you may not see our smiling faces as much because they'll be behind a mask for the next period of time, but trust in the fact that they are there, and trust in the fact that we're doing everything we can to have healthy people caring for you in your time of need. Thanks again for trusting in us, and keep that engine tuned. And I'll be back in touch again as the situation merits. So thank you very much.